I want to introduce myself. I'm Dr. Teona from Georgia, and our mission is help people be happier with health, with all procedures we are providing each day. So I want to make your life easier from today. I have a question. In past year, did you experience the lips complications with dermal fillers? Did you feel stress? So today, my main topic is about lips region. And my confession is that I had more than enough complications through my 5 years practice, especially on the lips region. But believe me, I had none with EpiTQ filler. So why EpiTQ filler? Because it will provide you less stress in your career. So key of not to have stress is to have enough knowledge with the products we are working and how to deal with all complication itself. So EpiTQ is process of the GTM research, and it's proved by European medical certificate, Korean and FDA. You have to know that it's zero serious side effects reported since 2017. And from this year is almost 2 million syringes sold. It has 1% lowest mode level among monophasic fillers. So EpiTQ has excellent cohesiveness, resulting in high lifting capacity, which giving us high G prime and ability to have a shape of the original with a long-lasting effect. So my suggestion is for you to use EpiTQ S100 or S300 for the lips. Let's consider that lip region is an extremely important area on the face. So rejuvenation of this region needs aesthetician, eyes, hands working with knowledge. So we have to use right product with right techniques to achieve success, which is not for one day. We need success for all our career. So what is lips function? It's food intake, articulation, tactile organ, erogenous zone, facial expressions, and its contraction, which is giving from orbicularis oris muscle. So from according my patient's experience, which was interesting for me, that patient recorded that their kisses was pleasant and satisfying. So be sure that EpiTQ is not blocking blood circulation or nerve innervation. It sits in the tissue very softly. So what about technique, which I'm using for these years? It's two main keys, linear and most important for me, no touch technique with mucosa while we are injecting dermal filler. So I'm sharing today the specific case in my practice. This patient asked me for help. She was injected by another doctor with another filler, with another product. So it is pictures which she shared with me before and after how was injection done. So you can see that after picture is already seen that it was poor technique and already was seeing that filler was sitting on mucosa, which was sitting there and it cannot be dissolved itself, even up to 1 year. So she visited me and asked me to do again lip filler, but I suggest her to make dissolving of migration as well, to make beautification of lip zones with standard and symmetries. So in this video, I'm showing you how I'm starting injections. I am using linear technique, vertical position. In this case, I choose EpiTQ S300 with 27G. If it would be virgin lips, like there is never had done dermal filler, I would make 30G. So you see on the video that I'm following the lines and trying, when I'm coming out of the skin, to stretch the skin as well. And for sure that know that I will have lifting effect. But while injecting, you see where is migration located, yes? Remember that the gray of the needle should never be visible through the skin. If it is, the placement of dermal filler will be superficially. This means that molding and massaging will not help. It will need to be dissolved with hyaluronic acid. So while injecting, you can as well mold with your fingers. That filler sits in the tissue perfectly. On another video, you can see that I'm making now horizontal technique for more strong Cupid's bow. And I'm continuing the lower lip with liner vertical technique for volumizing. So we have upper and lower lip symmetrical. So I want to share this like my standard of lips injection on this picture. So I'm planning how to inject lips. I am making like partly 1, 2, 3, 4. Why? Because when I did finished one side, and when I'm checking the patient, and if even I see that there is some asymmetries, don't worry, and please be objective and don't go again there and don't re-inject the same place, because you are not working for 1 day result. Remember, we need great result even after time, after 2 weeks, after 12 months. It should be all symmetrical. So once again, that I'm planning lips injection to the parts, right side and the left side. So when I finished and I stopped injecting, I never go back again. I'm not re-injecting in the same moments again. And on this picture is visualized how is filler sits in the lip zones. So sometimes I'm doing one liner techniques or 2 and 3 times. And why this case was interesting as well? Because while injecting her, I pushed capillaries and I started molding with warm compresses. I was checking. It will give us a progress. But after a few minutes, it did not. I hope you see on the video good as well. But with the color, I saw that this is not vascular occlusion by only the color. And patient did not have pain. So in this case, I injected saline, only saline. Now you are watching on the video that I continue to put saline on the lips where is migration. And why I did that? Because of expand overview, to see exactly later how the filler which was passed was done, where is the placement. So saline makes a little bit swollen of the tissue. And then I could see where I have to inject exactly hyaluronic acid for dissolving without damaging a new filler, which I had done in that 1 day. Now on that video, I'm using hyaluronic acid, but with 3,000 units, so strong one. So it's strong one, but I used 1 ml, not more. So in one same day, I did lips augmentation and plus migration dissolving. I want to say that you have to inform patient that after filler or after dissolving, there will be a picture of swelling. And this is physiological process in the body, which is because of macrophages and fibroblasts invade the filler, okay, and encapsulate the particles. So this is normal. 1-2 hours, it will disappear. And you will be for sure that after the patient leaves your office, that they will have symmetrical visualization of the lips. And the next video is shown after 5 hours of lips augmentation and migration dissolving. That you see that yes, there is bruising, little bit swelling, but that big swelling which was, it's disappeared already. And there is no anymore this migrated encapsulated fibroblasts. So this is after 2 weeks rehabilitation picture and video. So you see, while patient using hair muscle orbicularis oris, while speaking and smiling, you cannot see migration part, and it was dissolved very good. And this is picture of relaxed position of the lips with epitq S300. Let's consider about complications with the lips region. So we know that bruising is normal of any injections, but in vascular occlusion may appear pain, discoloration, and you have to check capillary position, how it's working. If it's poor, you may think that it's vascular occlusion. So stop injection in that moment. Start putting warm compresses and massage it. Yes, you see that on that video, on one place where I didn't know even it was occlusion or just bruising, but mostly it was bruising in my mind. Firstly, I used saline. So then I did hyaluronidase. And in case of helping, you can use heparin compresses as well for circulation activating. This is pictures showing of vascular occlusion with dermal fillers, HR. So you see on the first picture how HR filler is blocking arteries or veins. It's blocking arterial flow. Blood circulation is blocked. So oxygen does not go to tissue, and it may bring us to necrosis. And we are good doctors. We should never do that. And on the second picture, you see how it's unblocking that HR with hyaluronidase when we are sure and when it's vascular occlusion. You must know as well that maybe we will need extra help for patients. This means intramuscular injection with pentoxifilline. Maybe we will need to give antibiotics and prednisolone as well. So my suggestion is as well that in your office, there is adrenaline, oxygen, and emergency bag in any case of you are working. So what is migration exactly? So it's visible swollen upper or on mucosa. It's giving duck lip formation, like fake looking lips, and we are calling white mustache if it's on upper lip. So why it's happening? It may happen because of poor product was used, poor technique, and often reinjections, because sometimes patients are visiting us very often. If patient wants to look natural and beautiful, we are sharing when it can be done, lip filler injection. My suggestion is to make it after 1 year, and depends always on orbicularis oris, how it looks like. So my suggestion is how many can this lip afford the new filler? And on this picture is a very good visualization of migration of white mustache and how it looks like then after dissolving. But on this picture as well, it's not dissolved the whole amount of the lip dermal filler. It's only dissolved that extra what is in white mustache. This is after picture that looks really natural. And this is my pictures as well of dissolving procedure that I'm showing you how is the swelling, which we said already that it's going down after 1-2 hours. And on the last picture, you can see that already dissolved, how it looks like the virgin lips and how we reinject it and how it's looking like the natural way. And most common also complications is lumps and granulomas. So lumps appears immediately within the first 4 weeks. So mostly they cannot grow, but we can mold it and massage it. But even if something stays after injection, after 1 month, we can put hyaluronidase to dissolve just a little lump. But true granuloma appears lately after 6, 12, 24 months. And foreign body granulomas are not allergic, beside that fact that it can appear with redness, with swelling. And with granuloma, we can inject specific medications to make it dissolve. In this case, only hyaluron dust will not help. You can make a picture or screenshot on your phones which medicaments is used for true granulomas. This is, for example, triamcinolone, which is anti-inflammatory medicament. This is betamethasone, prednisolone, diprosone, these three. It's reducing inflammation. It's steroid, corticosteroids, but never rush, step by step. Let your patient say that they must visit you step by step, maybe each 3 days, each 5 days, and you control the situation. Never put too much medicament on granuloma as well. So I want to continue share my work with FPTQ with before and after pictures. I truly trust this product because it's really giving me good results for long-lasting effects. And always I'm choosing FPTQ mostly for me in, how to say, like in bad cases, when it's orbicularis oris specifically. And that's why with FPTQ S100 and 300, I'm using for maximized for lifting. So on the first picture, you can see before and after, and second picture. With FPTQ, I achieved with 1 ml, I achieved these results. And we are controlling our patients as we can with communication with them. And it sits the same way as I did in first day, because I shared my technique with you. Right side, left side, planning lips injection. And you will know that you will not need re-injection even until the patient will not come next 2 years to visit you for re-injection the lip zone. And FPTQ also as well giving me a good shape lifting and strong Cupid's bow effect. If they don't have even visualized Cupid's bow, with this filler and with this technique of stretching as well good, you can make visible Cupid's bow. You must try that technique. And on this picture as well, you see there is no visible Cupid's bow. And after pictures, you see that we did it. That was really nice. And patients are so satisfied. They never saw that in 1 ml, in 5-minute sessions, their face is fully changed. You can see on this first picture how this muscle is so strong. Sometimes I'm using botulinum toxin with the filler in the same day, but not as much as well, because with FPTQ, I really don't need it. This is as well FPTQ, but here I used 2 sessions with this patient. Thank you to everyone, and let's FPTQ.